Namaskar दोस्तों, welcome to channel Toxicology on board. Today in this video we'll be discussing another DABT topic that is few topics. The topics will be related to solvents. So under ABT 2026 brochure, under ABT syllabus you have solvent toxicology is also very important chapter. So few questions in the ABT recertification year 2009 we'll see some questions solvent related. Peripheral neuropathy, CNS toxicity. So workers who are working with this hazardous solvent, they have this syndrome called CNS neuropathy they will be having, that we'll discuss. Then we'll discuss about isopropanol poisoning with respect to this alcohols, whether it is ethanol, methanol, or isopropyl alcohol, which is the rubbing alcohol. You frequently will be getting questions in exam. At my time, kerosene related question they asked. Then ethanol carcinogenicity. Few videos I have already 4 to 5 videos I have uploaded with respect to ethanol, because ethanol is most frequently consumed by the humans, so exposure is high, so there are a lot of toxicity related to ethanol. So today in this video, one question with respect to cancer related ethanol we'll discuss. Then we'll discuss methylene chloride, for example, in which case methane CH4 is replaced with the two methyl groups. Then we'll discuss this methylene chloride, which is also called as dichloromethane. It has been listed under ISH Q3C Q3C guideline, that is residual solvents guideline. In that they have classified this dichloromethane under which type of, whether it is class 2 or class 1 or class 3, that we'll discuss. And there is a recent change in there is a revision, R10 revision is there with respect to this guideline. So there is a concept paper which is given in Jan 2025, that also we'll discuss towards the end of the slide. Let's dive into the question. So first question is taken from ABT recertification year 2000. So peripheral neuropathy question is related to peripheral neuropathy produced by hydrocarbon solvents. Hydrocarbon solvents is organic solvents which is having hydrogen and carbon as the main group, like benzene, like toluene, like styrene. Which of the following toluene, which of the following are the characteristics? So we have to identify. Before that, pause the video and also try to read about. There are different types of neuropathy. 4 types of neuropathy are there. I will give the link in the description. So I have made types of neuropathy also one video. There you can go and read about what is peripheral neuropathy. Different types of neuropathies are there. So what are the different parts of the body which are responsible, and which are the spinal nerves which are responsible for causing this particular type of neuropathy, you will be understanding. This question is related to peripheral neuropathy. So we have option. The right answer will be in the green text, that is dying back neuropathy. So this dying back neuropathy, you will also learn, come across this one in case of organophosphorus type of poisoning. Anticholinergic drugs will be there, no? Organophosphate also you will be learning about dying back neuropathy. Okay, from neuronal end towards the nervous system, towards the CNS. Okay, so one question with respect to dying back neuropathy you will be getting in exam. So even hydrocarbon solvents are associated with the dying back neuropathy, may involve metabolic conversion to ultimate neurotoxicant. So once this particular thing undergoes metabolism, it will form a metabolite which is highly neurotoxic, then may be potentiated by compounds such as methyl ethyl ketone. So few questions in the exam you will be getting with respect to methyl ethyl ketone, ketone, or methyl butyl ethyl ketone. So these, there are 4 to 5 types of like this methyl ethyl methyl butyl type of things which are listed even in ICH Q3C guideline. You can go back and check. They have taken if you look into the appendix of this ICH Q3C guideline, no, one particular solvent they have discussed as in a case study, case example also. I think that is methyl butyl ketone only, MBK, I guess. So go back and read that one. So whenever you are using this particular hydrocarbon solvent along with this methyl ethyl ketone, there will be potentiation of the effect. That is, again you have to come back to principles of toxicology, additive, synergistic, this, no. So may be potentiated by compounds such as methyl ethyl ketone, because you have to understand, when the workers are working in a certain industrial environment, no, they are not exposed to a single solvent. Okay, they are exposed to multiple exposure. Okay, so they have to work with different types of organic solvents. So they might be exposed to ethanol, they might be exposed to ketones, they might be exposed to some other type of solvent. So whenever these hydrocarbon solvents are used along with methyl ethyl ketone, there is a potentiation of the effect. Extended CNS neurotoxicity might be seen in the case of workers. May be reversible on cessation of the exposure. So few of the case studies you will be seeing, these workers know they work in 8-hour shift, and if the shift is, for example, from Monday to Friday, so when on Saturday and Sunday they are not working. So when they come back on Monday, so these 2 days, no, they have a rest period. So once the exposure is stopped, they will not feel any more this headache or this type of convulsions or this type of CNS related pain, that is neuropathy. Okay, so pause the video, try to go through this particular diagrams so that you can remember a picture in your brain. It will be easy at the time of exam. Next question we will see. This question is also taken from ABT recertification year 2000. The question is related to isopropanol poisoning. As I told you, know, different types of solvents. You have to read ethanol, you have to read methanol, you have to read isopropyl alcohol. In addition to that, solvents, no, because ethylene glycol, their metabolism is somewhat related. Some of the enzymes are also related, or they are in the same way. The pathway, the metabolism pathway is similar to that of some of the alcohols. So the metabolites which are formed in the case of ethylene glycol poisoning also might be related. So always try to correlate and try to read it. So today this particular slide we will be reading with respect to isopropyl alcohol, that is isopropanol. Okay. So as you can see, the enzyme which is involved is alcohol dehydrogenase. Here it can be ethanol dehydrogenase or methanol dehydrogenase, and the so once the metabolism is there, OH group, alcohol group is converting into ketone group. Okay. So isopropanol poisoning. Here the question is treatment related. If there is a person, for example, commonly this particular isopropyl alcohol is called as rubbing alcohol. Okay. So if there is any suicidal intention is there, or accidentally somebody has consumed this particular type of isopropyl alcohol, how when and that patient is brought to emergency department, how you are going to treat it? By administration of sodium bicarbonate, NaHCO3, as well as hemodialysis. So by dialysis also you can remove this particular solvent from the plasma, from the blood sample of that particular patient. Why inducing vomiting in the case of alcohol poisoning? Emetics, that is this one, vomiting, emesis, inducing vomiting is not the choice, and administration of ethanol. Ethanol will act as a it can be used for methanol poisoning. So whenever you come across a patient who has been methanol poisoning, the doctors, the physician will administer ethanol as an antidote for treating methanol poisoning. But in the case of isopropyl alcohol, no. So how we are going to treat it? With sodium bicarbonate and hemodialysis. This is the take home that you have to remember for your exam. And in addition to that, please go through, as I told, no, regarding ethanol, I have given some more videos I will give these links in the description. So they will keep on so many times, 10 to 15 questions on alcohol poisoning they will definitely ask. So please go through and try to remember. Next slide is with respect to ethanol. As I told you, major ethanol is fatty liver. The liver is the target organ. Another thing is that ethanol is causing cancer. So what is a mechanism that we will see here? So the question is taken from year 2009 ABT recertification, American Board of recertification, toxicology recertification question paper will be there. No, from that this question is taken. So possible mechanism of ethanol carcinogenicity include all of the following. So from the below statements we have to identify what is a mechanism for causing this ethanol poisoning. One is not associated with the methanol poisoning, that is immune function is stimulated by alcohol. So alcohol is not affecting your, it is not causing immune toxicity. So rest of the statements which are applicable to for ethanol mediated carcinogenesis, we will see how the ethanol is causing cancer. CYP2E1, as you know, ethanol for metabolism. This also you'll keep getting in your exam. Three enzymes you'll give you. One is alcohol dehydrogenase. They will give you CYP2E1. They will give you catalase. They will give you, and the metabolism is different in rodents as well as in non-rodents. That also you have to remember. Okay, so CYP2E1 induction by ethanol increases the metabolic activation of procarcinogens. So in the case of carcinogens also you have pro-carcinogens, you also have co-carcinogens will be there. So different types you will be coming across when you read carcinogens in detail. So this CYP2E1 is going to induce increases in metabolic. So whatever the pro-carcinogens are, it is going to activate that, okay, that particular Procarcinogens. Ethanol act as a solvent for carcinogens, enhancing their absorption into the tissues. Because of the phospholipid bilayer, ethanol is able to penetrate, so absorption into the tissues of the upper GI tract. Next, additives and contaminants in alcohol beverage influence carcinogenicity. Always, this is another bigger issue is that in order to make alcohol cheaper, there are a lot of cases. If you see historically, they will contaminate this alcohol. So gingerject paralysis also something which related to that incident you read. I have uploaded one video in my description also. So they will try to contaminate this alcohol with some other solvents, so those are going to induce this increase the cause of cancer also. Ethanol affects the action of certain hormones on hormone sensitive tissues. So it is going to mediate endocrine disruptors, hormone mimicking activity. So this is also involved. Okay, so pause the video, go through this particular mechanism, how what are the different what do you say metabolizing enzymes are involved. Like you can see aldehyde dehydrogenase, then alcohol dehydrogenase, aldehyde dehydrogenase, here CYP2E1 enzyme is there, and finally how reactive oxygen species, DNA adductor, DNA hypomethylation, DNA with CH3 groups attached. There will be histone will be there. No, once you understand the DNA, this unwinding of DNA, hypomethylation. So this is involved. One of the mechanism here in this alcohol is involved is DNA hypomethylation. So go back and read. Understand the structure of the DNA, how the chromosomes are formed, how the unwinding is taking place, how the methyl groups had histone demethylation. This term will come across. So read that one. So those things are involved in the mechanism. Pause the video, read this mechanism in detail. Next, we will see another solvent, that is methylene chloride. So this is being listed under ICH Q3C guideline also. So one question with respect to methylene chloride taken from ABT recertification year 2009. The question is, which of the following regarding methylene chloride is true? So we need to identify what statement is applicable to methylene chloride. So large number of people are exposed to methylene chloride both occupationally, means workers, and in home. So there are a lot of paint industry or some varnishing or some type of coating will be there, no? So there methylene chloride used, dichloromethane is used. In the US also lot of incidents you'll see if they are working with this solvent in a closed environment, no? So one of the metabolite which will be released is carbon monoxide. So those workers will undergo, if there is no proper aeration, they will undergo asphyxiation. Lack of oxygen will be there. So that we will understand in detail more. So lot of US case incidents will be there. That's why examiners they will ask question on this dichloromethane. So and in home, but systemic toxicity is there. Okay, so this particular methylene chloride, it is causing less systemic toxicity. Other options what are there, you can pause the video and go through. So it produces widespread toxic effects in the liver, kidney, CNS, heart. So these are not the target organs for this methylene chloride. With high repeated inhalation exposure, it is not carcinogenic in long term rodent bioassay. um, that what whether how the ICH Q3C also has classified this chemical, we will see. Then does not produce carboxy hemoglobin when inhaled. No, actually it will produce. I will explain you in the next paragraph. Individuals exposed occupationally commonly. So we'll see what is the explanation which is given by the ABT previously appeared students, DABT students. So methylene chloride only has limited systemic toxicity. This is a true statement. Reversible liver toxicity. Occasionally it will cause kidney injury. Okay, so the liver and kidney are not the major target organs for this dichloromethane. It is a carcinogen in the case of rodent. That is why, see here you can also see the category is carcinogen category 2, and carbon monoxide formed when it binds with hemoglobin. This again very important. So when you are reading about methylene chloride, read along with the carbon monoxide poisoning. One video with respect to carbon monoxide poisoning I have already uploaded in the channel. I'll give you the description in the link. So whenever this carbon monoxide is forming, no, it will combine with hemoglobin. So oxygen carrying capacity of this will be decreased. As a result, ATP or tissues will be deprived of the oxygen. So like that it is going to affect and it is causing the cell death. So carbon monoxide which is formed when it binds to hemoglobin, residual neurological dysfunction can happen but not common in occupational setting. Why I said? Because the person is working from Monday to Friday, is resting on Saturday and Sunday, so whatever the neurological symptoms, no, they will come down. Okay, so with respect to methylene chloride, elevated carboxy hemoglobin level, carbon monoxide poisoning, I have already, I'll give you the these two videos are there. Go through the video. I'll give the link in the description, and we will stop the video. As I told you in the beginning of the video, methylene chloride, no, CH4, methane. Methane is CH4, carbon with 4 hydrogens. 2 hydrogens are replaced with 2 chlorine atoms. That is the reason it is called methylene chloride. So other names are carbon dichloride. Okay, then it is what is it, dichloromethane. So most of the questions in the exam you might get with DCM and methane dichloride, because two carbons have been replaced with chlorine and methylene chloride. So question here is methylene chloride. Instead of methylene chloride, if they give you any of these three synonyms also, you should be able to answer in the exam. And if you look into the health hazards, as I told you, they have categorized this as carcinogenic category 2. Specific target organ they have not mentioned. So pause the video and go through. And this is the metabolism they were mentioning. So please, in see here, dichloromethylene chloride is also metabolism is CYP2E1. And as we see in ethanol also, CYP2E1 is also involved in the enzyme responsible for metabolism. Pause the video, see what are the final metabolites which are forming, which are responsible for causing this toxicity. Now we'll go to ISHQ3C guideline. So as I told you, this particular methylene chloride, it is listed under ISHQ3C. Towards the end, we'll see whether it is categorized as class 1, class 2, class 3. So you also go back and check ISHQ3C revision 9. Okay. So how they have derived permitted daily exposure, we'll see. Permitted daily exposure is the health-based exposure limit. So as you know the definition, PD is a substance-specific limit at which a person is exposed, he will not be having any harm even if it is exposed for a lifetime. This is the thing that you will come across in the pharmaceutical industry, particularly if there should not be any residual solvent in your final product. So dichloromethane is listed. So first, whenever you go through the ICH-Q3C document, no, first they will give one section with respect to genotoxic, whether this particular solvent is genotoxic or not. See, methylene chloride gives some positive results in vitro and not in vivo. So whenever you are doing risk assessment, no, in silico, in vitro, in vivo, like that you will be checking. So in vitro it is giving positive results, whereas in the case of in vivo it is not showing positive, it is showing negative. So this in vitro will be negated and you will be considering this particular solvent as negative for genotoxicity. And you have to understand this study is taken in 1981. Okay, if you look into the it's a very good journal, but it is from 1981. But now, as I told you, in the concept paper there are some changes are there. What are they that we will be seeing? And you have to understand here one more important point, that is there are a mixed results, like some tests are telling positive, some tests are saying negative. Then you have to apply weight of evidence approach. For example, here in vitro, if it is saying positive, in what strains, like if it is Ames assay, there are 5 to 6 strains are there, in which strain it is saying positive and in which strain it is saying negative, whether they are done in GLP or whether they are in non GLP, at what concentration, is it 2000 microgram per plate or 5000 microgram per plate, also is it with metabolic activation or is it with non-metabolic activation, that also then only you can make a decision. But here, since it is already given by the ICH committee, so we will not discuss, but your thinking process should be in that way. Okay, now we'll see they have discussed cancer study. One of the critical study they have under dichloromethane they have given is rats given inhaled doses. These are the doses: 1000, 2000, 4000 ppm, 6 hours per day, 5 days per week. Since it's a cancer study, it is a 2-year study. So what they have seen is increased incidence of benign mammary tumors at all levels, but no increase in malignant tumors. So in this 2-year cancer study in the rat, it is an inhalation study. The doses are 1000, 2000, 4000. They have find tumors, but those tumors are benign, they are not malignant. Okay, they are localized tumor, that is only in the case of mammary. And this publication is NTP report, that is National Toxicology Program. US will have this regulatory agency NTP, so they will identify certain chemicals which they feel have potential hazard. So they will do some toxicology studies, particularly 2-year rat studies, 13-week dose range finding studies, like that they will do. So this study was done in 1986. Okay, so what is the particular 1000 ppm is considered as as a LOEL in this case, because it is even at 1000 they find tumors. So here the point of departure is LOAEL, that is 1000 ppm. So once you have the doses in ppm, you have to convert it into mg per kg. So ppm is converted into mg per meter cube by how? By dividing molecular weight. Molecular weight is 84.94 of a dichloromethane. This you will get it from PubChem, and this 24.45 is your from this standard will be there, no STP conditions. From that you will be getting this 24.45. Okay, so you will be getting the answer the in mg per meter cube. Then you have to divide it by 1000. Once you divide it by 1000, you will be getting the value in mg per liter. Now you have to, since it is a 6 hours per day and 5 days per week dosing, you have to extrapolate. You have to 7 hours per day and 24 hours per 7 days per week and 24 hours per day. So here for continuous exposure, you are dividing it 6 by 24 and 5 days per week. 5 divided by 7 days in a week. So you will be getting for continuous exposure so and so value in mg per liter. Now if this 0.425, no, again when in the QC ICH Q3C guideline only, this is a table given. So they have very clearly given for a normal healthy rat body weight they have 425 grams, and if you look into pregnant rat body weight, they have given some other they have given pregnant rat body weight is 330 grams. So here since it is a normal, you have to consider 4 to 5 grams. So once you divide this grams into kg, this will be 0.425 kg. So how you are going to calculate daily doses? Whatever the 0.625 mg per liter you got it, no, you have to divide it with 290. This 290 you are getting it from here, the respiratory valve, rat respiratory volume. You will be getting from this particular table. Here rat respiratory value 290 liter per day. So 290 liter per day divided by 0.425 kg. So liter, here kg, liter, and this mg per liter will be getting cancelled. So you will be getting the units in mg per kg, that is 426 mg per kg. So LOAL was 1000 ppm. After following all these steps using this particular table, you will be getting the LOAL in the units 0 mg per kg per day. Now you have to apply this to your permitted daily exposure calculation. So here you have 426 into 50 divided by 5. 5 is for rat. Whenever you are extrapolating from rat, 10 is interspecies variation. 1 is, since it is a 2-year study, generally rat is 3 years life cycle will be there. At least half the 2-year study is there. Then you have to go for F3 as 1. F4 is 5. Here you have to understand critical point is that particularly in the case of ICH Q3C guideline, they have very clearly given. If you even to look into EMA guideline, or if you look into ICH Q3D guideline or some other guideline with respect to permitted daily exposure, they will not differentiate cancer. For carcinogenicity, higher conservative factor F4 they will consider a 10. But in the case of ICH Q3C only, in the appendix where they have given all this calculation, they have categorized cancer also again into malignant tumor and benign tumor. So since here in this study we have benign tumor, they have considered F4 as 5 instead of 10. If we do not have this one, we'll go F4 directly for 10, irrespective of whatever the type of tumors, whether it is benign tumor or malignant tumor, we go with higher conservative factor F4 10. But here our ICH committee themselves have considered for benign tumor, they have gone for lesser this thing, that is 5, because it is a localized tumor. After resurrection, it can be removed. And mammary tumors, probably they might have seen, I don't know whether they have seen only in males or females. You have to see the complete study. Here we do not have complete study. You can go back and check. Still in the NTP website, this study will be there. So 10, since LOAEL they have considered, there is the lowest observed adverse effect level. That's why higher factor 10 they have gone. And overall 5 into 10 will address whether it is cancer risk is there or not, and LOL. So 5 into 10 would be sufficient to address this uncertainty. So they got this value as 8.5 mg per day. This again they will convert it into ppm because they have to give these values in the specification. Once you do once your product you put it into HPLC or something, you will be getting specification. So they have to give these limits 850. That's why finally you have to convert this PD into ppm limits. Okay, this was one study. I'll not discuss other studies in detail. So similarly they have considered another study, inhalation 2-year. Again this is also NTP study. So you can pause and see, because I have explained how the conversions is there. So finally they ended up with 8 mg. But only thing I want you remember here is that in the previous study F4 5 we have taken because it was benign tumors. But here we are taking, see, lung and hepatocellular carcinoma at both levels. Means they have considered two studies, 2000 two doses, 2000 ppm and 4000 ppm. At both the doses they have seen that liver tumors are there, lung tumors are there, which are more dangerous, more hazardous. That's why they have taken higher factor 10. Since it is a LOAL, they have considered 10 for LOL. Since it is a mice study, they have considered 12. Okay, pause the video, go through, have take a pen and paper, do the calculation so that you will remember. Then next we will see a third study. So two cancer study, one was in mice, one was in rat. Now they have considered, first they discussed genotoxicity, then they have discussed NTP, two studies, mice and rat they have discussed. Now reproductive toxicity. So reproductive toxicity, here only one dose they have taken, and the observation is no teratogenicity. Okay. Um, this study is taken from 1980. Most of the studies, if you see 80, 85, 86, they have done conversions they have done. So since they do not find any teratogenicity, F4 is also 1 and Fi is also 1, because this particular 4500 was considered as NOAEL. Okay, pause the video, please go through the calculation. Then similarly we have another study which is taken from 1986. Okay, this is a publication, 2-year study is there. NOAEL is 6 mg per kg. So this is the final thing which they are considering as a final PD in this particular guideline. So little bit we'll discuss, 1-2 minutes we'll discuss here. So rat 650, 125, 250. These are the 4 doses they have taken. Rat drinking water, 2-year study. What are the adverse effects they have seen is reduced weight gain, fatty liver changes, areas of foci. Okay, no increase in neoplastic changes in liver or any other tissue. So the publication itself, the study director itself has given 6 is the novel. At 50, 125 and 120, 250, all these type of changes, whether it's decrease in weight gain, fatty liver changes, all these things they have observed at 50, 125, 250. 6 is the dose at which they didn't find any kind of changes. So 6 is considered NOEL. It is not even NOEL, it is NOEL. So this 6, this is the calculation what they have done. 6 into 50, 5 into 10, and since no changes, no adverse effects are there, all of them are considered as 111. If you see previous studies also, out of which least Noel is 6 is the one. So they ended up with value 6 mg per day. Final conversion is 600 ppm, and the conclusion is no carcinogenic risk with the case of dichloromethane, and PD for dichloromethane is 6 mg per day. I would request you go back and check which class. It is class 2 or class 3 that you see. So pause the video, also go through how it is metabolized, how the, if there are, whenever you're deriving this permitted daily exposure for a certain chemical, no, when you're preparing a PD report, so always you have to write the regulatory limits, regulatory limits also. And in case you have any human result, epidemiological studies are there, occupational some kind of observations are there, those things also you have to better you mention in your monograph, permitted daily exposure report or HBL report. Okay, so very quickly we'll go through metabolism, because one, you can go back and check one of the slide we have kept dichloromethane metabolism. See, methylene chloride is metabolized to carbon monoxide and carbon dioxide by mixed function oxidase systems. So remember, MFO, mixed function oxidase system, is very important. Similarly, carbon monoxide and carbon dioxide are forming. As I told, carbon monoxide, when it forms, when it combines with hemoglobin, carboxy hemoglobin will form. So oxygen carrying capacity of this hemoglobin will decrease. Okay, when these systems, that is mixed function oxidase systems, become saturated, a disproportionate amount of metabolized via the glutathione S transferase, we have seen this one, system producing reactive intermediate. Mice have much greater glutathione activity than rats or humans, therefore more metabolism by this pathway. So pause the video and go through. Another important thing you have to learn from this statement is different species will have different types of metabolism will be there, slight changes will be there. Here, as the statement says, mice is showing higher metabolism when compared to rat and human. So whatever the metabolic pathway in the case of animals, what you see, it should be similar to that of the human, then only you will be able to compare it. So this is very, very important learning here also. Okay, pause the video and read. Another last important thing that I want to you to read and go through is that, as I told in the beginning of the video, till now what we discussed about methylene chloride or ICH-Q3C revision 9 guideline. So there is a recent change, that is in Jan, there is a concept paper under discussion by the ICH committee. You can go back and check in their website. This is the thing. So this is the concept paper. So Jan 2025 they have proposed. So in that concept paper, it is only 2 to 3 pages document it is there, but they have discussed, they have mentioned about dichloromethane also. So whenever there are certain changes, there is a high possibility that such kind of question you might get in your exam. So final concept paper Q3C R10 impurities guideline for residual solvent dated 26 November 2024, endorsed by the management committee on 6th January 2025. So you can see revision 10 it is. So whenever few changes will be there, no, so they put it in the form of revision, they'll put it in a public domain, then after discussion, after Q&A, then it will form as a guideline. Okay, so another thing is that you have to remember is this HBL reports or science, it is a dynamic. So whenever new information comes, there will be change in this values of this HBL values also, whether it is permitted daily exposure or occupational exposure limit or ADI. These regulatory limits, they keep on changing. With respect to nitrosamine impurities also, you have seen earlier regulatory will submit one particular value, but once you get more information, they change this value, whether it can be increase or decrease. So like that with respect to this solvents also, because the see, industry cannot run without solvents, you need solvents. Okay, and some of the solvents are hazardous. Okay, whether if you see benzene, toluene, or alcohol, you will be get exposed to this one. You need these solvents to in order to dissolve your pharmaceutical to prepare. But the important thing is that in the final product this solvent should not be there. There should not be any residue in the final product. Okay, that is the thing you cannot avoid. You have to work with these solvents. But what precautionary measures that you can do in order to avoid any toxicity, that you have to, as a toxicologist, you have to give to your whether R&D or FR&D team. Okay, so I will not discuss much. You pause the video and read. Go through this paper yourself, download and read. Only first paragraph, this particular thing will discuss. ECHA. ECHA is nothing but European Chemical Agency. So there is a recent change in ECHA website also. Now they are giving the toxicology data, whatever the physicochemical data in a different format. So you go through that also. So this is coming from a Europe this one. ECHA reviews a proposal for reclassification of dichloromethane from class CARC2. In the beginning we have seen, no, to class CARC 1B. So what is the classification? You go back and check. IARC also gives some classification. FDA also gives classification for the sake of pregnancy. So similarly for cancer also you have different categories are there. So ECHA is proposing that let's make dichloromethane from class 2 to CARC 1B they are suggesting, and they are giving some evidence also why they are suggesting this change also, because you have to see, we have seen in the beginning also, the studies are done in either 80, 85, 86, something like that. Today we are in 2026. Around, I don't know, 20, 30 years are there. Okay. And adds classification as muta2. In the beginning, they tell it is not mutagenic. Okay. Now they are proposing that let's make it mutagenicity 2, it seems. So you go through what is the classification. This will classify dichloromethane as mutagenic carcinogen. As you know, different carcinogen, you have DNA, that is direct carcinogen, directly the carcinogenicity can be classified in two types: the DNA damaging or non genotoxic mechanism of causing carcinogenesis, where different mechanisms are involved. The translation or protein synthesis, those methods will be involved. Here, in the case of direct DNA causing carcinogenesis, here directly this particular agent will attack the DNA and it will cause cancer. So they are suggesting that let us include dichloromethane as a mutagenic, means it is going to cause a DNA damage, it is going to cause mutation, thereby it is going to cancer. This is a proposal given by the ECHA. Mutagenic carcinogens would be ICH-Q3C class 1 solvents. The expert working group EWG will evaluate the data foundation for the change of classification by the ECHA, and if necessary will revise monograph, whatever the discussion we have done, no, PD different studies. Okay, and classification in Q3C. So this is the thing. Pause the video, go through. I don't know, they have not given they have given or not, somebody you can put it in the comment. This is what I have come across in the available time which I had. Okay, so thank you so much. Be curious. For any questions you can always write a mail to arya.priyanka18@gmail.com. Hope from this video you were able to learn about, first of all we have learned about peripheral neuropathy. Okay, different types of neuropathy you read. Then that is hydrocarbon solvents, solvent related CNS toxicity, that you will be occupational exposure you will be getting in exam. Some historical cases are also there, they will ask you one question. Second one is we have learnt about isopropanol alcohol. There how you are going to treat if there is any alcohol poisoning, what are the antidotes that you have to read. Then we have discussed about chemical carcinogens, what is the ethanol mechanism, how it is causing cancer. Okay, CYP2E1. There are three enzymes which are involved in ethanol metabolism that you read. So in case of, along with that also read, if methanol is undergoing metabolism, what is the toxic metabolite form, like oxalic acid or will be formed where it will affect the kidney, and methanol will be causing what is it, blindness. So that you read. In addition, also read glycol poisoning, like ethylene glycol poisoning. You read about MBEK, that is ketone, MBBK ketone type of this thing, solvent toxicity also. And in detail we have discussed about dichloromethane, that is methylene dichloride. So we have discussed the previous guideline ICH Q39, their parameter daily exposure, how the different factors, how for cancer you have decided whether for benign tumors what factor you have to give for F4, for malignant what factor you have to give. Then we have discussed concept paper 2025 recent changes, that also we have discussed. So this video is bit lengthy, but I tried to cover as many points as I could with related to that concept. So all the best for your exam.